training isn't always accessible in developing countries, but Orbis have come up with a solution to it. I'm here today with Bruce Johnson, who's going to tell us a little bit about this aircraft that we're on.
Hi, how are you doing? Good morning. This is a MD-10-30. It's our third generation aircraft that we have had a hospital in. It's a one-of-a-kind eye hospital. We do eye care, and we go over all over the developing world for the last 34 years. It's a MD-10 freighter, and we've actually installed a hospital in it, and it's actually freight. It's not part of the plane, but we connect it on the ground, get it all set up, have the staff come in, do our surgeries, take it all apart, fly to another location.
Wow. So such a specialized aircraft must require a really specialized team behind it. Tell me about the team that are working on it.
Certainly. We have a complete staff of people. When you look at a hospital, we have doctors, we have nurses, we have anesthesiologists, biomedical engineers, we have aircraft mechanics because it's an aircraft. The aircraft mechanics have to do hospital maintenance, changing filters, running the generators. We have pilots that volunteer our time from other locations. We have office staff, admin, finance, logistics, everything you have to have in a regular building, we have in a plane. It just moves.
So we're standing in an aircraft. How did you turn it into a fully functioning hospital?
Well, our second generation airplane, both our first and our second, the airplane and the hospital were married together. We decided that to be able to have more flexibility and also to separate the airplane for certification processes, we made the hospital freight. So we took a freighter aircraft, put a 9G barrier in it, everything behind the hospital, and we made containers. And each department has its own container, slid into place, left it there. Whenever we have to work on the airplane in some upcoming years, we can remove the hospital, upgrade the hospital, maybe even move it to another airplane.
You train them up and then you fly away. Is that how it works?
Well, the philosophy ours is training, sustainable training. Sort of the philosophy is like teach a man how to fish. So we train the local doctors, healthcare professionals in that country that we've had a relationship with. So we come in, they have had an assessment of the patients that we're doing that week or that every other week, whatever we're there, usually 2 to 4 weeks. We just finished a 4-week program in Cameroon. So we work with the local hospital, assess the best patients for the best training. Then we do those surgeries both in the local hospital and on the airplane. And we change subspecialties every week. So we get a new set of specialists to give more training each time to the locals.
It sounds like an expensive operation. How do you fund all this?
Well, we're a nonprofit organization, so we completely operate. Everything we do is for free. So it's either private donation or corporate donations, which we have many corporate sponsors, whether they give us what we call gift in kind, like maybe an aircraft tire, or they donate to the simulator program, like we have here. We're actually here from one of our new donors, UTAS, which is going to be funding our new simulator program. FedEx also, they donated the airplane. The pilots are theirs. All the equipment, the tires and all that kind of stuff comes from them. So it's aviation industry is really neat. We have tons and tons of them. I've named a couple. We also have pharmaceutical companies in the medical field. It's all either donation of money or donation of equipment or manpower.
Sounds like innovation for the greater good. For the latest industry news, subscribe to wearefin.com.